Hey everyone! Today, I'm diving into something crucial for every medical student to understand: aortic dissection. It's a condition that can be both fascinating and, let's face it, pretty scary. So, what exactly is an aortic dissection? Imagine the aorta, the largest artery in your body, as a three-layered tube. A dissection happens when there's a tear in the inner layer, causing blood to flow between the layers. This creates a false lumen and can lead to a whole bunch of complications. Now, why does this happen? There are several risk factors. High blood pressure is a biggie, along with connective tissue disorders like Marfan syndrome. Trauma, pre-existing aneurysms, and even certain surgical procedures can play a role too. Remember, it's often a combination of factors that leads to dissection. Let's break it down further. Aortic dissections are classified into two types using the Stanford classification. Type A involves the ascending aorta and is more common and more dangerous. Type B is limited to the descending aorta. The type determines the urgency and type of treatment required. Clinically, patients often present with sudden, severe chest or back pain. They might describe it as tearing or ripping. And because the aorta supplies blood to the entire body, symptoms can vary widely, from stroke-like symptoms to limb ischemia. It's crucial to recognize these signs early because time is of the essence. Diagnosis typically involves imaging. A CT angiography is often the gold standard because it provides detailed images of the aorta. MRI and transesophageal echocardiography are also used, depending on the situation. Treatment varies based on the type and severity. Type A, dissections usually require emergency surgery to prevent rupture or other complications. Type B dissections might be managed medically with blood pressure control, though some cases need surgical intervention too. Managing blood pressure is key in both types. Medications like beta blockers can help reduce the force of blood against the aortic wall. And lifestyle changes are crucial for long-term management. So, what's the takeaway? Aortic dissection is a life-threatening condition that requires prompt recognition and treatment. As future doctors, it's vital to understand its mechanisms, risk factors, and treatment options to save lives. That's it for today's quick rundown on aortic dissection. If you found this helpful, hit that like button and don't forget to subscribe for more medical insights. Stay curious and keep learning. Catch you next time. So